Welcome to the first module of HIPAA Privacy and Security Training for Emergency Medical Service Professionals. The HIPAA rules were written with the idea that healthcare providers work in controlled settings, like a hospital. But emergency medical services are the special forces of healthcare, your first responders working in the field, facing a wide variety of situations in patients every day. This training is specifically designed for you. It covers topics EMS professionals are most likely to see on a run. You'll learn how to assess a HIPAA privacy situation quickly and do the right thing, just like when you assess and treat a patient. You'll see that HIPAA rules are easy to follow, step by step, when you know the steps. The training has 5 modules. In Module 1, we'll look briefly at HIPAA basics. What is HIPAA? Why is HIPAA important? What do some key terms mean according to HIPAA? And we'll close by previewing the next modules that cover HIPAA in day-to-day EMS work with real-life examples. Let's get started. What is HIPAA? It is a federal law that sets national standards to protect the privacy and security of personal health information, your patient's health information, and your own health information. HIPAA law applies to what it calls covered entities. Healthcare providers are covered entities, and EMS professionals are healthcare providers, so you must follow HIPAA law. HIPAA is enforced by the U.S. Department of Health and Human Services, the Department of Justice, and the State Attorney General. Investigations usually start when a patient complains their privacy rights were violated, or if there is a violation called a breach. That is when someone gets your patient's information they're not allowed to have. HIPAA violations can bring civil money penalties like fines paid by your EMS organization. You also could be charged with a federal crime, but only if you steal medical identity to make money or publicly embarrass somebody. HIPAA doesn't allow patients to sue healthcare providers for HIPAA violations, but lawyers have filed malpractice cases charging that the failure to protect PHI violates a standard of care healthcare providers owe to patients. Why is HIPAA important? Yes, it's the law, but it's much, much more. Health information includes our most sensitive private information. The confidential relationship between healthcare providers and a patient is the bedrock of high-quality patient care. So HIPAA is about the quality of health care you provide. Patients trust you to treat them and trust you will keep their information safe. To treat a patient, you need truthful information that you won't get unless the patient trusts you. And unfortunately, it's also about risk. There are all kinds of people, good and bad. You see them every day. The bad, the criminals, have made medical identity theft a big, highly profitable business. Medical identity is the gold standard for identity thieves. This triggered massive public and private warning campaigns like this.
Many people know the dangers of having your identity stolen, but most people are unaware of the fastest growing form of identity theft. Medical identity theft occurs when someone steals or unlawfully uses your personal information like your name, social security number, or Medicare number.
Medicare fraud cannot be committed without 2 pieces of information: the identity of a provider and the identity of a patient.
That's important. With just the identity of a provider and identity of a patient, a thief contacts the patient, pretends to be a provider, and gets more information. It's called social engineering. The FBI explains partial medical identity of a person, your patient, you, your family, is worth $50 on the black market compared to $1 for a Social Security or credit card number, because it's used to commit health insurance fraud and get prescription medications. Identity thieves are everywhere, trying to steal health information about your patients. These are some key HIPAA terms: protected health information, or PHI, use, disclose, notice of privacy practices. Let's look at how the HIPAA rules define them. First, protected health information, or PHI. The definition of PHI starts with the definition of health information. Health information is information that describes the physical or mental health condition of an individual or the provision of health care to an individual that is created or received by a healthcare provider. In other words, it is information you create and receive beginning with your assessment of a patient. The definition of PHI continues with the definition of individually identifiable health information. That is health information including information like a name that can be used to identify an individual. The HIPAA rules explain in detail exactly what kind of information can identify an individual. They are called identifiers. Here they are, 18 different types of identifying information, any one of which, tied to a patient's physical or mental health condition or provision of health care to the patient, is individually identifiable health information. And finally, PHI is individually identifiable health information transmitted by electronic media, any portable electronic device you use, like a laptop, maintained in electronic media, again, any electronic device you use, and transmitted or maintained in any other form or medium, like paper forms, records, or notes you make. Use and disclose. Use means using PHI within your EMS organization. Disclose means releasing or transferring PHI to anyone outside your EMS organization. EMS may use or disclose PHI only as permitted by HIPAA law. Notice of Privacy Practices, or NPP. An NPP explains to a patient how your EMS organization is permitted to use and disclose the patient's PHI, your EMS organization's legal duties concerning PHI, and the patient's rights concerning his or her PHI. Now let's look at the HIPAA topics covered in the next 4 training modules. Module 2 will cover the NPP. When EMS may disclose PHI will be covered in Module 3. Tips on avoiding HIPAA violations is the subject of Module 4. And we'll close with a brief discussion of how a national emergency or disaster affects EMS HIPAA compliance requirements in Module 5. So to wrap up, in Module 1, we have reviewed what HIPAA is, why HIPAA is important, key HIPAA terms for EMS professionals, and previewed the topics of upcoming HIPAA privacy and security training modules. When you finish this training, I think you'll see that for EMS professionals, HIPAA rules are easy to follow, step by step, when you know the steps. 2 final notes. Make sure you check with your HIPAA compliance official anytime you have a HIPAA question or concern. And, this is important, don't hesitate to report any possible HIPAA violation you see to your HIPAA compliance official. It may not be a violation. If it is, corrective action may be taken and needed. It will be a much bigger problem if it is not reported and comes to the attention of the authorities later. And whether or not it is a violation, it can be a good learning point for your entire EMS organization. This concludes Module 1 of HIPAA Privacy and Security Training for EMS Professionals.